Are you interested in a career in imaging services? Let me take you behind closed doors and explain what we do. The world of radiology branches into different areas, and all of them require a knowledge of both human anatomy and physics. General radiography, or X-ray, uses X-rays combined with computers to obtain images of patients to see if they have any type of fracture or pathology. All areas of radiology send the images to a doctor called a radiologist, and that's the person who reads the images or uses them to diagnose if there's something going on with the patient. The person who takes the images is a technologist. Seen here is a portable X-ray machine, and we can use this to go into a patient's room if they're very ill and they can't move around at the hospital, or maybe they've had some sort of trauma and they're being treated in the emergency department. This mobile X-ray unit is called a C-arm because of its shape. And we take this to surgery to assist with different types of surgeries and procedures. So X-ray technologists frequently go to surgeries and participate in the care of patients while they are under anesthesia, from anything from fixing a broken bone to placing a device or implant. Another area that uses X-ray radiation is CT, which stands for computerized tomography. The sources of radiation spin around the patient very quickly, which is why the machine is shaped a little bit like a donut. The result of this is images that are very thinly sliced, allowing us to see a lot of detail in the soft tissue and bony structures of that patient. An area that has thinly sliced images like CT is MRI. Instead of using radiation, we have a strong magnet that never shuts off, paired with radio frequency, and it's processed through a computer. This gives us detail of muscle structures that you cannot see on a general X-ray. Another area of radiology that does not use radiation is ultrasound. Ultrasound technologists use a transducer or probe to transmit ultrasound waves into the patient, and then it records the echo back from the patient, resulting in an image. While most people relate ultrasound to babies, ultrasound procedures are actually performed on any soft tissue or organ structure, including the heart. What's life really like in imaging services? Well, our patients are real people. So you'll see blood, you'll see vomit, and you will see poop. Sometimes we actually perform certain types of exams, like in general X-ray, a barium enema. And that means you are giving an enema to a patient. Now you'll learn the right precautions to keep you safe during those procedures so you're not exposed to those body fluids, but it's important to know that you will see them. Sometimes our patients are extremely sick. Sometimes they've been injured severely. And that might just mean that you have to take images during an emergent situation. Imaging services is right for you if you care about people. Imaging technologists are a big part of our patients getting better. Quality images are a part of diagnosing patients so that they can receive the treatment and follow-up that they need. How do you become a technologist? Well, you have two options. You can do some general education and then apply for a 2-year program at Ivy Tech or Olney Central College. Ivy Tech has both a general X-ray or a radiography program and an ultrasound program. The second option is attending a 4-year program, and the result will be a bachelor's degree. 4-year programs often include general X-ray and then another area or modality of radiology like CT or MRI. All programs have clinical time, so these are days where you go to a hospital or a clinic and you are hands-on with the patients obtaining images, and you get that real-life experience before you graduate. How do you know which program to pick? Well, that really depends on what your ultimate goal is. If you attend an X-ray or radiography program, that will get your foot in the door to apply for jobs in other areas like MRI, CT, or interventional radiology. If you're really interested in ultrasound, then apply for an ultrasound program. As we mentioned before, ultrasound is more than just babies. So there's a general sonography program and a vascular sonography program at Ivy Tech. All medical imaging programs end in graduation, but your journey doesn't stop there. You'll then need to take a registry. This is an exam to test your knowledge of the discipline that you pick for imaging services. That registry will qualify you for a job within imaging services. Now, if you go to a general radiography or X-ray program and then pass your registry in general radiography, you can use that registry to apply for an area like CT, MRI, or interventional radiology, even if you don't have any experience. Here at Union Health, we will help train you in that area, and then you can take the registry that is specific to that modality, like CT, at a later time. Ivy Tech also offers a class on CT and a class on MRI to help you pass that registry. If you're considering a career in imaging services, go for it. Reach out to your local college that you're interested in their program, or us here at Union Health Imaging Services. We're happy to help you see what your journey might look like.